Thank you all for tuning into our presentation today. My name is Justin Chun, and I, as well as the students involved in this project, are all pharmacy students from the organization Asian Pharmacists Association, and we're under the University of Illinois College of Pharmacy. And we're thrilled to explore a mental health topic that often is not discussed enough. Although we are not mental health experts, the students spent a great amount of time researching their respective topics to provide their appropriate analyses of what they learned. But without further ado, let us begin exploring the mental health and obstacles among APIDA-identifying individuals. For those who are unfamiliar, APIDA stands for Asian Pacific Islander Desi American. With any presentation, we just wanted to provide a topic outline to show what we will be discussing throughout this presentation today. And before we get started with our presentation today, I wanted our presenting team to introduce themselves.
Hi, my name is Ashley Fanko, and I'm a P1.
Hi, my name is Michael Zhu, and I'm a P2.
Hello, my name is Sean Martin and I'm a P1.
Hello, my name is Jessica Kim and I'm a P1.
Hi, my name is Diane Veroya and I am a P2.
Hi, my name is Alexa Abernilla and I'm a P2.
Hi, my name is Sherry Lan. I am a P1.
Hi, my name is Kat Lee and I am a P1.
We also had another team of students who worked on supplemental materials for this project, but will not be presenting with us today. This team included Tenzin, Zeba, Mary Louise, Alyssa, Tina, Christine, and Mai.
We will begin our discussion with the first generation immigrant populations, specifically focusing on the cultural values and societal roles that may contribute to mental illness in this population. Starting off, from a 2018 survey, 6.1% of the US population identifies as APIDA, and of that percentage, 15% reported mental illness. That brings the total APIDA having mental illness to be 2.9 million. I want to especially put emphasis on reported, as this number underestimates the actual number, which is most probably higher than the 2.9 million reported. Now let's go into reasons why mental illness is so prevalent in the APIDA population.
First-generation immigrants often face culture shock and stigma, especially with the topic of mental health. Statistics show that about 40% of immigrants are less likely to be aware or utilize mental health accessibility since mental illness in Asian culture is a taboo subject or even non-existent. It is embedded in the culture that mental health is a topic that is looked down upon or non-existent, which creates a barrier in obtaining help for mental health problems for first-generation immigrants.
For many APIDA households, America became a way to escape war, recession, or political turmoil. Moving to America meant surviving, but first generation immigrants were left in a new country with a new language and a completely different culture. With this comes the obvious language barrier, but also an alienation, where Asian Americans are told to go back to where they belong. Other than the culture shock and stigma, traditional societal roles such as collectivism, the role of women and men, and racial profiling all may affect the mental health of these individuals. Collectivism is the practice or principle of giving a group priority over each individual. In a collectivist culture, family matters more than the individual, which can lead to mental strain as priorities are not on the individual's needs.
Racial profiling and discrimination of first-generation immigrants affect mental health also due to the fear that is instilled from feeling judged from those who look different than them. This idea was supported in a 2019 study that found that there was a negative correlation of perceived overall discrimination with mental health. This suggests that if an individual receives perceived discrimination, then their mental health will decline. Perceived discrimination is defined as a behavioral manifestation of a negative attitude, judgment, or unfair treatment toward members of a group. With the recent Asian American Pacific Islander hate, it has been confirmed that Asian Americans receive discrimination simply because of how they look. In many first-generation immigrant populations, women tend to be ignored after they talk about their mental health issues as well. They are expected to do household chores and have minimal control over their decisions since they are expected to follow commands. Men are also ignored if they express their emotional or mental health because their expectation is to be a capable leader to guide their family. To do so, they mustn't show any signs of weakness. These cultural and societal gender roles are also embedded with the culture of having high familial expectations.
This slide shows a Japanese proverb that serves perfectly as an example of collectivist culture. The nail that sticks out gets hammered down. This is explaining that in collectivist culture, conformism and not sticking out is seen as better than acting out or reaching out. Saving face and hiding problems is better than letting anybody know that you are suffering. This cultural value wears down the first generation parents, but also gets passed down from generation to generation. In addition, APIDA populations have a tendency of having high familial expectations. Asian immigrants uproot their entire lives, sacrificing everything in order to come to the land with new opportunities and greener pastures. With this sacrifice comes a need to succeed, where parents expect their children to do well in school in order to make up for the sacrifices they made to survive and make it to this country. Parents propel their own hopes and dreams onto their children, intending the best for them and wanting perfection, but realistically placing enormous pressure onto them. While children may perform well in the classroom, their stress may be overseen because teachers still see them succeed.
The concept of filial piety is also prevalent in the Asian culture and was carried through the immigration to America. For Asians, importance is placed on respecting elders, and part of that respect is seeing elders as the absolute authority and representing the family unit in the best way possible. Failing to perform to the standards of the family can lead to mental strain. In Western/European cultures, authoritarian parenting is avoided as it is seen as hostile and dominating, whereas Asian cultures see authoritarian parenting as a sign of care. Quote unquote tiger mom was created as a slang term referring to extremely overbearing Asian parents, which encourages success but discourages individuality and self control. As explained earlier, Eastern values are more placed on the unit rather than the individual, which can lead to academic achievement and successes, but also leaves the individual not fulfilled emotionally. Distress can be overseen due to the highlight of academic achievement, in part because that achievement is a reflection of successful parenting.
From personal experience, I've had times where I would get a 97% on a difficult exam, and instead of acknowledging my achievements, my mom would ask me what I can do to get a 100% on the following exams. From the viewpoint of Eastern parents, nothing is fun until you're good at it. Practice makes perfect, and reaching that perfection is the ultimate goal.
Eastern values center around an idea to succeed from the sacrifices made while immigrating. However, communication is hindered as filial piety discourages disrespect towards authorities. This is shown in more passive forms of communication. Western values differ in more care towards individualism. Authoritarian parenting is unfavored due to being seen as excessive. Westerners communicate more directly and are not afraid of being seen as disrespectful towards their audience.
After looking at mental health in first-generation immigrants, we will now shift our focus to the mental well-being of APIDA-identifying young adults. Mental health in APIDA-identifying adults is impacted by the concepts of guilt and shame. These terms are often used interchangeably, but they are in fact different. What do they really mean, and how are they different? First, it is important to explore the difference between guilt and shame. Guilt is the negative evaluation of the individual's behavior or action. In other words, you experience guilt when you feel bad about what you did. On the other hand, shame generalizes this negative evaluation to the whole self. You experience shame when you feel bad about yourself as a person. Think of it like this. Guilt is something along the lines of, I did something bad, versus shame being, I am bad. Both guilt and shame are implicated in poor mental health outcomes among APIDA youth. Translating what we just learned about shame, next we want to talk about the impact of interpersonal shame on APIDA mental health. Interpersonal shame comprises of external shame and family shame. External shame is the shame arising from others' evaluation of the self. A 2016 study found that external shame is actually strongly linked with favorable help-seeking attitudes. In other words, an increase in shame triggers a strengthening of attitudes motivated to prevent the experience of additional shame. The greater external shame one experiences, perhaps one becomes more motivated to seek psychological help when experiencing major difficulties. On the flip side, the same motivation may be due to experiencing distress symptoms, as distress symptoms are positively associated with favorable help seeking attitudes. Now, the other side to interpersonal shame is family shame. That is, the shame stemming from the perception that one has brought shame to one's family. Those who experience high levels of perceived discrepancy between one's family standards and one's performance might perceive that their inadequacies have dishonored their families, which is why it's called family shame. This in turn triggers greater levels of psychological distress. This goes back to the idea of family perfectionism, in that love is conditionally given based on an individual's achievements. The greater the family expectations, the more one perceives family shame and lead to negative psychological distress. This internalization of distress then gives rise to poor mental health outcomes, often manifesting as depressive symptoms, anxiety, low self esteem, and even suicide ideation. This is crucial because the Asian value of family recognition through achievement may have a stronger negative impact on help seeking attitudes than being shamed by others. After all, being shamed by those who are close to the individual can be seriously detrimental to their mental health. As a result, APIDAs are the least likely racial group to take actions on their mental health and are more likely to reach out to friends and family instead of licensed mental health professionals. However, not all APIDAs have a strong support system and can have difficulty expressing their challenges due to guilt, shame, or even not being able to speak the same language.
As mentioned earlier, guilt is the negative evaluation of the individual's behavior or action. But how does this manifest within the individual? Shame precedes guilt and is often associated with global feelings of maturity and flawed character brought to one's attention by a parenting adult. In many APIDA identifying individuals, guilt and shame can manifest when their self perception of their own acts is dictated by familiar expectations or honor to others. This shows a real or symbolic exposure of one in the eyes of an audience. Whether there is an audience or not that can provide judgment, shame and guilt still may occur because it is manifested psychologically. This manifestation creates an emotion that builds a perception within that individual on what they should be feeling. Guilt may motivate a desire to also compensate or seek absolution. When an action has been done, one may question if it is justifiable. Though it may start as justification for themselves, it may have stemmed from their own vulnerability or fear of judgment. With this, many APIDA identifying individuals may bear the weight of responsibilities within their families. These obligations and responsibilities, when not met, have the capacity to accumulate guilt. When tasks continually aren't completed, one may question whether they are capable of meeting their obligations, which goes back again to the core idea of being vulnerable to judgment.
Now, this slide shows a quote from Dr. Jeffrey Liu, a psychiatrist in McLean's Behavioral Health Partial Hospital Program, explaining mental health stigma in the community. The quote reads, "For some Asian Americans, there's a real sense that your value as a person depends on your ability to take care of your family and community. This way of thinking originated, for East Asians, from an ancient philosophical tradition called Confucianism. Mental illness is seen, and I should emphasize incorrectly, as taking away a person's ability to care for others. And for that reason, it's seen as taking away someone's identity or purpose. It's the ultimate form of shame. The takeaway message from the quote is that the role of shame in mental health shouldn't go unnoticed, as it stems from both familial and cultural values."
The familial and cultural values that lead to guilt and shame creates an overall reluctance in APIDA populations to seek help and most times not to professionals. This is often caused by many household factors and the dismissive opinions of mental health. Asian American parents tend to contribute the most to this attitude and pay less attention to mental health overall. Many first generation immigrants that are now parents lack a proper understanding of their own traumas and mental health. The avoidance behavior that many Asian American parents have towards mental health end up heavily influencing the expectations of their children. They are forcibly adamant about the idea that their children are supposed to be naturally happy and successful, even though outside factors such as racial discrimination and language barriers continue to negatively impact their children's mental health. As a result, most Asian Americans often seek empathy from close friends and grow reluctant to seek help from family or licensed mental health services. Oftentimes, this is because close groups of friends tend to experience more similarities in life. They are thus more willing to listen, express both empathy and sympathy, and are generally much easier to access than healthcare. However, a great percentage of Asian Americans are still not reaching out to others for help and tend to cope independently. In an opposite perspective, this is a prime example of a lack of resources where healthcare professionals tend to fail to recognize the need of mediation for APIDA individuals who lack the courage to ask for help. This population is unfortunately underserved and are more prone to having untreated mental health issues. This is typically due to limitations such as stigma and the taboo of seeking help for mental health, which are huge factors for the lack of understanding of coping. There is an overall stigma that Asian Americans are strong willed, intelligent, industrious, and are fully in charge of their own lives, that the Asian American population itself seamlessly integrated into society. And the misleading part is that the world seems to truly believe that this stereotype is true for the entire Asian American population. Thus, the APIDA community disapproves of burdening others with personal problems or faults. This creates circumstances where, despite being fully aware of their mental health, some Asian Americans may not reach out because of the community's expectations. For instance, admitting that a weakness, such as being thought of as being weak or crazy, would be letting down the entire community. Parents then reinforce this by emphasizing acts of saving face and protecting their family reputation, which develops a common behavioral issue of constantly comparing their own children to model relatives or other Asian Americans of their age. This leaves Asian Americans that feel insecure about themselves with feelings of confusion, shame, and overwhelming amounts of self failure that often result in severe silent struggles.
Lack of resources can also play an important role in Asian American mental health. First of all, there isn't great access in most communities, especially due to language barriers. Language barriers lead to lack of understanding of coping, which prevents effective communication between people and leads to unsuccessful effort to overcome mental health issues. People with language barriers can also become the targets of racial discrimination and leads to worsened mental health. Second of all, insurance is also a factor that inhibits many APIDAs from seeking help. Lack of insurance coverage prevents APIDAs from seeking the optimal treatments to improve mental health. Although mental health services have increased their capacities, it is still insufficient to meet the care demands for Asian Americans with mental disorders. Some challenges include lack of mental health legislation, lack of human resources, lack of hospital beds for patients, and shortage of mental health services. There's little to no training in cultural responsiveness or understanding in mental health service providers or medical professionals. In addition, there's more demand in spiritual values and consideration of the culture, indicating that there's need for dual culture experience. Furthermore, clinicians must be more aware and sensitive to Asian stigmas, indicating it's important to focus more on holism. And this leads to current outlook on mental health and strategy on the next slide.
Luckily, there is a current outlook and direction on bettering APIDA mental health and strategies. Current sources show that mental health screenings differ between each ethnic group. APIDA screenings found that APIDA groups listed suicide as the most prioritized mental health issue, followed by depression and substance use. APIDA populations are aware of the leading issue of suicide and constantly press for the need for suicide screening and find that the most primary care physicians do not prioritize mental health screenings with Asian American patients compared to other ethnic populations. Luckily, screenings are now more highly sensitive to APIDA populations that are prone to drug use. High substance use was found to correlate with mental health illnesses and increased suicidality in ages 18 and older within the past 4 years of screenings. The locations were also recorded where self-help groups were the most common place of occurred used substances and have become areas where polysubstance use is addressed, screened, and treated. With this change, a greater push for more education has been set, where it has been proved to be highly effective with younger Asian American populations, aged 12 through 17 and 18 through 25, resulting in the substance usage percentage to drop from rates of 1% to less than 0.5% and 3.3% to 1.9% respectively. With that being said, current practices are starting to include proper assessment of several factors that include putting the patient at ease, acknowledging that there are natural language barriers and offering sufficient interview time. Screening for substance use and suicide risks are also more important now than ever, as well as the awareness of the patient potentially exhibiting stoicism, such as denying sadness, depression, or other psychiatric symptoms. Ensuring the patient that everything is private during and after any mental health screening. Most importantly, tailoring to Asian culture where there is more insight on the Asian mind body, perspective, and an overall inclusion of traditional beliefs and interventions. However, other factors make each screening different within APIDA populations. Age is one factor that plays a huge role in this procedure. Younger populations were found to prefer actively discussing their mental health problems with a health expert rather than close friends and family. Oppositely, older populations prefer medication as a mental health treatment, most often believing medications to be the sole treatment option rather than discussion with another person. This is reasoned by the fact that this requires less English proficiency and an overall reduced cultural stigma, where any problems with the health can be easily fixed. Most importantly, this reduces the frequency of psychotherapist visits and any risk of exposure to personal mental health statuses to the community. Gender as a direct result of cultural expectations is another factor that contributes to mental health screenings and vary for each individual. Male populations partaking in studies were found to express more stoicism than the observed female populations. Within the PETA communities, many of these individuals are restricted in ways of expression and are highly common within ages 12 through 25. Oftentimes, these individuals struggle to find their uniqueness and resort to higher dependence on substances, which then lead to suicidality. However, the observed female populations expressed more suicidal intentions, including suicidal thoughts, planning, and attempts. Many of these individuals, specifically between ages 18 through 45, express that they are constantly pressured to be more worthy in a constantly changing world to compete with their male counterparts. However, this is greatly restricted due to ongoing gender inequality battles that eventually result in a loss of motivation and suicidality.
If we take a look at mental health statistics, the American Psychological Association reports that suicide is the second leading cause of death for Asian Americans between the ages of 15 to 34 years old. This data is consistent with the national data indicating that it is the second leading cause for 15 to 24-year-olds and the third leading cause for 25 to 34-year-olds. Amongst the different genders and age ranges observed, there are distinct differences in suicide rates. In 2019, high school aged women displayed higher suicidal ideation than men of all ethnicities. Asian American women were observed to have at least 15% difference in suicidal attempts. Although more women developed ideation, Asian American men led in death rates by nearly 11%. With the alarming statistics provided, many Asian Americans underuse mental health services, despite their vulnerability to diverse mental health problems. The Asian American population is aware of this problem, but more awareness and action needs to be done.
So, what are some organizations that raise awareness and exposure about mental health? Vibrant Emotional Health is an organization that strives to supply those in need of emotional and mental support. Some specific resources they provide are phone call, text, and chat resources to help individuals on a national scale. They provide more than 20 national and local depression and suicidal hotline calls to those who in need of it. Some specific examples are the National Suicide Prevention Lifeline, where one can dial 988, the Veterans Crisis Line, and the Disaster Distress Helpline. They also provide the NYC Well program, which is more focused on the local community of New Yorkers as they provide counseling sessions with individuals and refer these individuals to areas for treatment and support resources.
Another organization that raised awareness and exposure of mental health is National Alliance on Mental Illness, also known as NAMI. National Alliance on Mental Illness is the nation's largest grassroots mental health organization dedicated to building better lives for people who are affected by mental illness. The organization regularly hosts mental health awareness events annually, which help others to become more familiar with how to improve mental health. It also provides resources such as seminar, ebooks, and presentation to help and educate those who suffer from poor mental health. The seminar and presentations specifically choose people who have mental health issues in the past. As a result, people with mental health can now learn how to overcome their mental health issues from them. In addition, the organization regularly publishes Advocate magazine, public policy reports, and survey reports to help people up to date with the current events that are related to mental health.
National Asian American Pacific Islander Mental Health Associations, or NAAPIMHA for short, its goal is to prevent suicidal individuals, especially the youth, providing affordable and resourceful mental health resources and facilitating mental health consumers. They emphasize that immigration, education, healthcare, and social justice issues are in need of equality and awareness. They specifically provide mental health fact sheets in multiple languages like Japanese, Korean, Thai, Vietnamese, Mandarin, and more to help those who are not proficient in English to become educated and learn about mental health. Further, they primarily created the Asians in focus due to the increasing racism against Asians. One project they are currently focusing on is the Heart's Hope project, where their main goal is to raise exposure to Asian Americans about mental health and suicide prevention. They achieve this by allowing people to submit an art piece or creative expression about mental health or suicide. This project specifically works with the Native Hawaiian and other indigenous community. Raising awareness and exposure has helped many individuals take initiative to receive treatment for their mental health. According to the CDC, more than 20.3% of adults are taking prescribed drugs specifically for their mental health, went to therapy, or received both in 2020. However, studies from the CDC reported that anxiety and depression has increased from 2020 to 2021. From August 2020, about 36.4% of adults greater than the age of 18 reported having depression and anxiety. In early 2021, this percentage increased from 41.5%. Factors that might have caused this increase in depression and anxiety could possibly be due to the pandemic.
Cultural competence refers to the awareness, knowledge, and skills and the processes needed by individuals, professions, organizations, and systems to function effectively and appropriately in culturally diverse situations in general and in particular encounters from different cultures. The cultural competence framework has been utilized in many mental health services to raise awareness. However, it has flaws that are not suitable for dynamic nature of cultures. Some of the flaws include ignoring differences in powers and present-day oppression experienced by cultural groups, disregarding the participation of the clients and their community, and not basing on the reality and the constantly changing and transforming nature of cultures. As a result, the cultural partnership was developed. The cultural partnership development indicates the relationship between the therapist and the clients, and the focus must be to move from traditional relationships built in power relationships to a more interdependent and synergistic relationship. As a result of these cultural partnerships, This leads to the development of different coping strategies to improve mental health, which we'll be discussing on the next few slides.
The amount and type of coping strategies might require depends on how difficult things are, hence ranging from self-care and social support from loved ones to seeing a counselor or therapist, similar to how us would see our doctor if we had a flu. For crisis situations, call a crisis line, and if your safety is at risk, call emergency service. The phone numbers are listed here. So for coping strategies, we have two separate strategies. The first part is professional strategies. You can always seek help from therapists or counselors. They're specialists in mental health treatment through psychotherapy. And you can also seek help from social workers. There are different types of social workers. They generally approach mental health from a social perspective and are familiar with social factors such as housing and meeting basic needs. Other than that, you can also search help from psychiatrists. Unlike other roles, psychiatrists are doctors and can prescribe medications if there is a need. And like clinical psychologists, psychiatrists also have more extensive education and training. Other than seeking help from people, there are also several useful professional resources in many websites. Feel free to check it out if you're interested in. So for non-professional strategies, we can always searching help from our loved ones, friends or families, may be the first people you reach out to when things are difficult. They can be a great resource since they often know you well. They are easy to get in touch with and can help you seek out more support. Peer support centers are also very useful. Many college campus offers peer support programs where you can talk to a trained volunteer who is often not a student, who can listen and is familiar with campus resources. Other than that, there are also a lot of online, phone, text, or distress lines. Depending on the line in question, you will most likely get a trained volunteer who is similar aged, similar to peer support center. Support lines are great because they are more likely to be more available outside of business hours, such as evenings, weekends, and public holidays. Most importantly, exercise is always a good strategy that can help cope with mental health issues.
So, what steps can you take now to cultivate your own mental health? The Anxiety and Depression Association of America recommends these top 5 strategies that we can incorporate into our day to day routine to lay a healthy foundation and maintain our mental well being. The first step would be to protect your sleep. Your life depends on it. As students, it is one of the most easily neglected aspects of our everyday lives, and it has significant implications to daily performance and long term livelihood. Good sleep hygiene entails behavior such as keeping a regular sleep schedule, going to bed around the same time each night, not eating a heavy late meal, watching TV in a room other than your bedroom, turning the TV off 30 minutes before your bedtime, as well as putting down any electronics about 30 minutes before bedtime. The screen, even on dim mode, can still be stimulating to the brain via the eyes. The second recommendation would be to maintain a balanced diet. Our eating habits can play a large role in our mood regulation throughout the day, so we need to make sure that we choose foods that are right for our body. The third tip would be to get regular exercise. For substantial health benefits, adults should do at least 150 minutes a week of moderate intensity exercise, which equates to about 20 minutes a day. Even taking a short break from work to move your body or stretch can be beneficial to your body. The fourth suggestion would be to get involved in your community. Interacting with others reminds us that we are not alone and gives us an outlet to share our thoughts and feelings. In our context, it would be incredibly helpful to seek out resources within the APIDA community. And the last and final tip would be to find a hobby. Engaging in an activity that brings us pleasure and enjoyment has a physiologic effect on our brains, triggering a release of neurotransmitters which play an important role in fighting depression and anxiety. Remember, activity activates us all. Including these fundamental activities in your day-to-day routine will change your life for the better. Your positivity will also begin to affect everyone around you. By following these 5 lifestyle choices, we put ourselves in the best position possible to prevent the onset of depression and anxiety. Although we typically try to eliminate habits, these are 5 healthy habits we should all try to implement in our lives for a better way of living.
Thank you all so much for listening to our presentation. We have provided our email as well as our social media if you have any questions regarding the presentation. As well as that, we have provided our references that you will be able to access on the next few slides.